Okay. Good morning, and welcome to the Collaborative on Health and the Environment Alaska teleconference on the role of health impact assessments in decisions that affect communities, a case study of proposed coal mining in the Matanuska Valley. My name is Diana DeFazio, and I'll be facilitating today's call on behalf of Alaska Community Action on Toxins. HIA Alaska is a regional partnership group of the National Collaborative on Health and the Environment. HIA Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. You can find more information on the websites www.healthandenvironment.org and www.akaction.org. The call will last 1 hour. Except for the speakers, all participants are muted during the presentation. And after our two speakers, there will be time for questions and discussion. And again, there's no visual component to this presentation, so it's just audio only, and there were no handouts or anything that you need to have. We chose the topic of health impact assessments, or HIAs for short, because this is a process specifically aimed at assessing the health effects of development projects. The National Academy of Sciences recently endorsed the inclusion of health impact assessments as important in environmental review. HIAs have been used internationally and are gaining traction in some states, including Alaska, as a voluntary process for assessing health effects among potentially affected communities. It's my pleasure this morning to introduce Dr. Liz Snyder, who will discuss the need for comprehensive health impact assessments and policy decisions and some of the opportunities and limitations presented by the HIA process. Dr. Snyder is Assistant Professor of Public Health in the Department of Health Sciences at the University of Alaska, Anchorage. She holds a master's degree in Global Environmental Health from Emory University and a PhD in Soil and Water Science from University of Florida, Gainesville, Florida. Her research background is in risk assessment, and her areas of interest include health impact assessments, fate and transport of soil and water contaminants, environmental health, environmental justice, wastewater treatment, and waste management, and emerging contaminants of concern. Liz, would you like to begin?
Oh, sure. And Diana, I think I'll keep it into my allotted time here, but will you holler at me if I'm getting long-winded, because I don't want to cut into the other components of the call?
I will. You have until 10:30, and I will let you know when if it seems like you might go over.
Okay, great. Okay, great. All right, so I'll jump on in. I think as promised on the email announcement that went out, what I was going to cover this morning, and Diana, you touched on it a bit, was just to highlight what I plan to touch on here, an overview of the HIA process. So I realize for some folks calling in, this may be a bit of a review, but it'd be nice to make sure that we're all on the same page and operating from the same definitions. And we'll talk a bit about what they are, HIAs, how they're initiated, who's involved, and how it's decided what we look at. Also talk a little bit about the need for comprehensive HIAs and policy decisions and the relationship to environmental impact statements. And then finally touch a little bit on opportunities and limitations of health impact assessments as a process for evaluating development projects. So just to do a quick definition of health impact assessment, if we turn to the WHO definition, which is what's commonly cited, when we talk about an HIA, we're talking about a combination of procedures, and I'm just reading the definition here, procedures, methods, and tools by which a policy, program, or project may be judged as to its potential effects on the health of a population and the distribution of those effects within the population. And when you perform an HIA, what we're doing essentially is we're bringing together scientific data along with public health expertise and, very importantly, stakeholder input. And HIAs are most commonly done outside of what's traditionally considered the health sector, so trying to bring health considerations into development or project or policy decisions that historically have not considered the impacts on human health. And most HIA practitioners will be quick to point out that HIAs are not intended to either promote, nor are they intended to delay or stop a decision. And I'll talk a little bit more about that at the end of my time here. And a little more background on HIA. We can do desktop HIAs, or we can do quote-unquote rapid HIAs, or comprehensive HIAs. And the desktop And the rapid HIAs are really the most common for a variety of reasons, mostly because they're a bit quicker, they require fewer resources, you're using existing data, because you're trying to get in ahead of a decision and be able to inform that decision. Comprehensive HIAs, on the other hand, they actually collect new baseline health data and sometimes environmental data. And but what all of these approaches have in common are some basic steps. And depending on the guideline that you look at, there's typically about 6 steps of an HIA, all the way from screening through to scoping, through to assessing. And then there's varying names. You make recommendations, you report those recommendations, and this last step, monitoring and evaluation, just as important as any of the previous steps, and oftentimes, unfortunately, tends to get the short end of the stick. So screening, we're essentially determining whether or not an HIA should go forward. Is what available data exists, what's the relevance of health to the decision that we're assessing, and whether there's actually an opportunity for health information to be used in the decision-making process. And if you come away from that screening step, then you're probably going to, with available data, you've identified data, and it looks like, yes, you can inform the decision, then you would move into scoping. And at that point, you're making some more definitive plans for how you're going to conduct an HIA. You begin identifying some potential health risks and benefits of the proposed project or policy. Identify communities and subgroups that might be affected, stakeholder concerns. And then from there, you would then move into assessing. So starting to take a deeper look at that data that you've collected, describe the baseline health of the community that you're looking at, being sure to identify vulnerable populations and describing existing conditions. And there's a variety of ways that you can analyze that data, and there's no really one set way. Folks don't always like that answer of how you would analyze that data. You can take quantitative approaches, there's some qualitative approaches, there's some ranking and prioritizing methods, but there's no necessarily one right way. And that's probably good because there's so many different types of projects that you can assess using the HIA methodology. But within, so in scoping, you try to identify all the possible related health effects. And then in analysis, you might actually end up focusing on just a subset of those health effects. And while there's no necessarily one way how to focus in on what health effects you're going to look at, you do want to utilize stakeholder input and an HIA practitioner input on how you narrow that down. But essentially, it needs to be it's not set in stone, but you really always need to provide justification for why you are taking the approach that you're taking. And then finally, you don't just want to identify health risks and benefits, but you need to, ideally within an HIA, you're going to make recommendations. And these recommendations, they need to be feasible, and feasible within the political context, within the economic context, the regulatory, as well as the technical context. Can these recommendations actually be done? And as I mentioned before, you want to report that information to the decision maker, whoever that may be, and also to various stakeholders that are involved in the process. And then finishing up with monitoring and evaluation. And when you're doing monitoring and evaluation, there's really 2 types of evaluations that we're interested in. You can get into the nitty-gritty of talking about different types of evaluation, but basically you would, 1, evaluate the actual HIA process, how it was performed, how people were able to contribute to the process along those lines, and then also evaluate the HIA with respect to, did it actually inform the ultimate decision that was being made. To give us a little bit of context of HIA, the history of HIA in the United States, we are a little bit, you could say, behind some of the other nations in the world. Europe has been doing HIAs for quite some time, and they've made a little more progress in standardizing the process and integrating the process. But if we look at HIA in the United States, our attention usually turns first to the National Environmental Policy Act of 1969, as we all know as NEPA. And for those of you not familiar with NEPA, which I'm sure most of us are, it was a national policy, quote, to encourage productive and enjoyable harmony between humankind and its environment, seeking to stimulate health and welfare, and create and maintain conditions under which humankind and nature can exist in harmony. And under NEPA, it established the environmental impact statement, or the EIS that we hear about. And EIS is really the federal name for what is more generally called an environmental impact assessment. Assessments are generally reserved for when they're done by state and local agencies. But under an EIS or an EIA, agencies evaluate and disclose predicted consequences of a decision with the potential to significantly affect the human environment. And historically, EISs have not broadly considered human health impacts. And there are some arguments for why an EIS really should include health in the assessment. Well, one, the language of NEPA really does require an analysis of health effects. It's in the language of NEPA itself. But further, you could make the argument that including health effects would actually strengthen the EIS itself. And HIA is really, it's a good way to do this because it's compatible with the process of performing an EIS, and it's compatible with the requirements of NEPA. But it's important to point out that HIA is also useful outside of the NEPA process. And if we look at some simple stats on EIAs in the United States, we'll realize that most of the HIAs actually will be done outside of the NEPA process. If you just think about the thousands of EIAs that are conducted in the U.S. each year, only about 500 of those each year are EISs done under NEPA. So there's lots of opportunities for HIAs to be done not within the NEPA process and even as standalone assessments. To give you an idea of how HIAs have grown in the U.S., in 2008, a group of researchers found that about 28, almost 30 publicly available completed HIAs, and just 2 years later, that number had been bumped up to 65. So as this call would attest to, HIAs are gaining some traction here in the United States. And if you think about the history of HIAs, really the history of HIAs in Alaska is a big part of the history of HIAs in the United States. And the state of Alaska really is setting an example that other states, and I know US EPA is watching. And in fact, if you take a look at the first integrated HIA EIS, so integrating HIA into that NEPA process, that first one was done right here in our state of Alaska in 2004, and that was the North Slope Health Impact Assessment, and it involved several oil and gas leasing proposals in that region. Many of y'all might recognize the name Aaron Wernham. He spearheaded that, led that effort when he was with ANTHC. He's now with Pew in D.C. And then in 2008, so 4 years later, there was an HIA conference held here in Anchorage, and out of that conference, a working group was developed. And just recently, a toolkit of sorts, a guidance document for HIAs in Alaska, specifically focused on resource development projects and improving stakeholder involvement, was produced, and that's now available on the State Impact Assessment Program website. And also in response to findings of that working group that came out of that 2008 meeting, that very program that I just mentioned, the Alaska Department of Health and Social Services established the HIA program, and that just was established in summer 2010. So we're just over a year having a state HIA program, and that's unique within the United States. And if you look at the recent, just to give you an idea of what's going on in the state right now, if you're not already aware, if you look at the bulletin that was put out by the state in July 2011, it sounds like there's multiple HIAs either in the works or on the books or being planned or actually being done. So we've got the Alaska Pipeline Project, the Chewitna Project, Donlin Creek, Foothills West, Point Thompson, Pebble, and Wishbone Hill, which I know Shauna is going to talk about today. So getting away from the history a little bit and talking a little bit about the need for comprehensive HIAs and policy decisions, first, it might be useful to highlight some of the impediments that we see, generally speaking, to healthy public policy, not necessarily with HIAs in mind, but public policy in general. Why in the past haven't we considered health? And there's a few reasons that have been identified. One is this lack of priority being attached to health and well-being. More we're a society that up to this point has really focused on addressing health impacts after they've occurred rather than prevention. And we're doing better in that realm, but that is our history a little bit. We commit resources to the end rather than the beginning. We've seen a research policy practice gap, so even if we have researchers collecting data, they're not necessarily talking to the policymakers and vice versa, and they're operating in isolation, and the structures aren't in place. And that's changing. We're starting to see that change. Our state HIA program is a case in point. Policy without action is another thing that can be limiting. Even if we do have the evidence to inform public policy, it really has to be accompanied by implementation and monitoring and evaluation to actually see an effect and an application of that data. And we also see a dominance of commercial power in some instances that seems to hinder the process. Not always the case, but that's definitely on the table. And if we're talking about EISs, where do EISs in relationship to HIAs fall short historically? In 2000, and this might have changed, and hopefully it has changed, but as of 2000, it was estimated that about 90 to 95% of all EIAs actually lacked appropriate health and safety assessment considerations. And there's a variety of reasons for that, really. Lack of expertise, scarce resources, lack of time, lack of coordination, lack of available baseline data, or even an absence of standardized methodology. And again, that's improving. We're seeing a growing body of HIA practitioners in the U.S. We're seeing a growing body of resources available as evidenced, for example, by the Clearinghouse of HIA Information through UCLA, or the HIA Gateway through the Association of Public Health Observatories, or absence of standardized methodology. There are multiple guidance documents now for conducting an HIA, and not just for conducting an HIA, but there's a growing body of literature on how to incorporate stakeholder input, how to incorporate the input of various experts, whether you're talking about air quality experts or water experts. There's a growing body of literature on how to evaluate an HIA and whether it was done in the best possible way. There's also, when we're talking about where can EISs fall short, there's also some challenges to public participation. I think we all appreciate that EISs can commonly be huge documents and fairly complex documents, and if you don't have the background and training to engage in that process and to interpret that process, or you don't have someone who does have that experience helping you in that process, you could be at a disadvantage. So if you're not familiar with EIA procedures or EIS procedures and protocols, or with what environmental health data already exists or how to access it, then you might find yourself at a disadvantage when it comes to participating in that process. And then finally, I guess I'm moving a little quickly, just to touch on some opportunities and limitations of health impact assessments as a process for evaluating development projects. And I guess I'll start with the limitations. Mitigation for public health effects is not always enforceable. I think that's the big one. That's kind of the elephant in the room. We really don't have, there's no generally accepted criteria at this point for when an assessment should be conducted. And what this often leads to is essentially the squeaky wheel getting the grease, right? So HIAs aren't done consistently, and which could feasibly have some environmental justice implications. The good news is, with respect to environmental justice, that oftentimes when HIAs are done, environmental justice is one of the considerations you're worried about, particularly vulnerable or historically disenfranchised populations. And so, I mean, if we don't have HIAs that are enforceable under existing regulations, some opportunities might be to work on some new local, state, or tribal requirements, to work on new monitoring or preventative initiatives, and those initiatives might best be initiated by public health advocates, whether they're in academia or in public health practice or with various state organizations, or even voluntary agreements with industry. At this point, sometimes that's your only option. And if you look at some of the the information that Aaron Wernham, the fellow that I mentioned earlier, who's been heavily involved in spearheading the HIA efforts in the state, he found that working with Alaska's large project permitting team, it does have the potential to develop agreements with industry to address site-specific issues that might fall outside any sort of specific regulation, with the hope that there's latitude for the state and industry to agree on specific mitigation measures that are protective of public health. And that, of course, comes with its own public perception problems that really do need to be addressed. Another limitation that needs to be addressed, currently at this point, HIAs are done usually in whatever time frame is available prior to whatever decision you're looking at being made, as opposed to the decision waiting for the HIA. So what this often translates to, and this is common not just in the United States, but this happens in Europe as well, but what this can often lead to is making predictions and recommendations in a relatively short time frame, and sometimes with incomplete data, which, depending on the policy or project, can be an acceptable approach, or it can be an unacceptable approach. And again, you do have some public perception problems with that. Another limitation at this point, and hopefully this will begin to change, but funding for HIAs is commonly a problem. Up to this point, a lot of the HIAs have been funded through private foundations, say such as Pew, or small federal grants. But this really isn't a sustainable process. I mean, if we're only seeing 65 completed publicly available HIAs that have been funded in this way, but we're having thousands of EISs, of which some percentage would benefit from including an HIA, we really do have to have another long-term funding source become available. In some cases, permit fees, if you're talking about resource development projects, can be used to fund HIAs or agreements with agencies that are cooperating in the process. But these approaches too have their flaws, particularly if it turns out that these permit fees, if it's perceived or if it actually is happening that these permit fees are coming from the actual project that's being assessed. Another limitation that really does need to be addressed is agencies, they actually might be reluctant, right, to add health to a planning and regulatory process that already requires substantial investment of time and resources. EIS it's a long, involved, and expensive, resource-intensive process, and the appeal of adding in another step is not always very great. But that said, recommendations of HIAs really are more likely to be accepted by decision makers. We've found in research of previously conducted HIAs, if the decision makers are involved in the design and the conduct of the HIA, if there's an organizational commitment to the HIA, and if the statutory frameworks which provide legitimacy for an HIA are within the policy process. And we're still working on that latter part especially. And then finally, to get to this public perception problem, and Shauna, I think I should have talked with you before, but I expect this will probably come up at some point, if not in your presentation, but maybe in the discussion session. But this perception of HIAs possibly becoming a tool not just for the protection and promotion of public health and being a neutral document and not an agent for promoting nor for impeding or stopping a project. But particularly in a study conducted in Europe, they looked at almost 20 different HIA or HIA-like processes and tried to get a handle on the effectiveness of HIAs and how they played a role in the decision-making process. And really what was found was that all the HIAs that they looked at resulted in, the good news was that they resulted in modification of certain aspects of the pending decision. But and depending on who you ask, this is a positive or a negative, but in no cases did an HIA actually work to stop a project. And ideally that's not what an HIA is for, but you can see how even when you're looking at recent publications on how to, a very recent publication, a very good publication I should note, I know some of the folks that put it together, but some of the justifications that practitioners cite for conducting an HIA is that it can promote community buy-in on a project. And for some folks, that really is a problem, and it raises some red flags on the utility of an HIA and how much stakeholders ultimately might want to participate in the HIA process. So that's just another limitation that really does need to be addressed as we move forward and start to really institutionalize the process of HIAs. And Diana, that's what I had to talk about in my allotted time. I know I'm a few minutes ahead. Would you like to go ahead and pass the torch to Shauna?
Sure. Thank you, Liz, for your excellent overview. And I also wanted to just point people's attention that on our website, on the call page, there are links to the State of Alaska Health Impact Assessment Program website that Liz mentioned, and also to the Health Impact Project, and to the UCLA HIA Clearinghouse, which has links to just numerous articles sort of tracking the history of the use of HIAs in the U.S. and perhaps internationally as well.
Oh, and Diana, if I may, talking about that UCLA website, they've done a nice job, from what I understand, of really trying to identify the best HIAs, some exemplary HIAs. So what you do find there, you should be able to take as good examples of HIAs.
Thank you for adding that. Thank you. Next, I'd like to welcome Shauna Larson. Shauna is Alaska Program Co-Director for Pacific Environment, and Shauna is Atna Athabaskan from Chickaloon Village on her father's side, and Supiak from the village of Port Graham on her mother's side. Shauna spent 9 years with Alaska Community Action on Toxics before coming to Pacific Environment, working on the Stockholm Convention, which is an international treaty that focuses on banning some of the world's most toxic chemicals, also known as persistent organic pollutants. She served 4 years on the Chickaloon Village Traditional Tribal Council and was selected by the Utne Reader magazine as a young visionary. Shauna has worked extensively in community organizing at an international, national, and local level. Shauna, would you like to begin?
Good morning. Thank you. Hi, everybody. Thank you for that very nice welcome. And this has definitely been a very hot topic and very much a topic of interest and concern in our community in Chickaloon. As Diana mentioned, I'm the Alaska Program, recently became the Alaska Program Director for Pacific Environment, and our organization is a organization that combines not only environmental aspects but also social justice aspects, and so blending sort of those two areas to come forward with work that really incorporates all of the things that from a tribal perspective cannot be separated. You really can't separate human health or our culture from the environment and from the animals, from the air, from the water. All of those things cannot be separated. And so our program particularly works on making sure that all those aspects are incorporated when we do work, whether it's on oil and gas or shipping or any of the coal work that we do, any of the areas, program areas that we work in. In our community in Chickaloon Village, we've been very impacted in the past by the coal mining and the railroad that came into our area. In the early 1900s, essentially, there were approximately 800 indigenous people in our area, and a few years, I think it's 6 to 7 years, the mining came into our area as well as the railroad, and after they left, after the 6 or 7 years, there were only 40 people left. And our elders and ancestors talked to us about how that was related to disease and lack of food, alcoholism, all the different things that our community people, our tribal people, were not used to being exposed to, that came in very rapidly and sort of began shifting the cultural aspects and the social aspects that our tribe had come to know at that time. Essentially, with the huge influx of mining came, obviously, a lot of men were coming into the area to do that mining, and some women and children were brought in during that time, but it was in particularly a lot of men that were looking for jobs kind of from all over, and those men were looking for not only jobs, but I think also to figure out how to create lives for themselves. And that really meant getting wives and having children and settling down in different areas. And so that really begins the story of how our great-great-grandparents were impacted when people from the outside came in. There was a man who is our great-great-grandfather that took a wife. He was in his 30s and she was 13 years old at the time, and that wasn't something that was, it was a territorial law at that time, and so there were no laws in place to say that those kinds of things couldn't happen. It was something that our great-great-grandmother's parents were very concerned about, but there wasn't anything that they could do about it necessarily. And so our story really starts from there, and from that unfolded many years of generational trauma and a lot of health impacts and social problems that we still suffer from today. I can say that all my parents were alcoholics and all my grandparents were alcoholics, and I truly believe that that came a lot from the rapid changes that evolved in the early 1900s and from the mining coming in. And so it's interesting to have the conversation about health impact assessments and how to define what health means. Are we talking about physical health? Is this about, how long you can stay on the Stairmaster? Are we talking about mental health? Is this, something, that we're talking about can be cured by potentially meditating or, exercising or having a good spiritual health? It's interesting to really try to figure out how we're defining health. There's spiritual, mental, emotional, physical, community health, all those different aspects. And from, as a tribal person, I really believe that those things cannot be separated out, and it's very dangerous to begin compartmentalizing those things. I think there also is a huge concern in terms of, and I think it's something that gets overlooked quite often, which is tribes. We have, for those of you that don't know, 229 federally recognized tribes in the state of Alaska, and those tribes are tribal governments. They have a very special recognition by the federal government, and I'll send around a link so that people can see, but there's the Department of Interior's Federal Indian Trust Responsibility, and it states the Department of Interior is legally obligated to ensure that American Indians and Alaska Natives resources and lands are properly managed, protected, and conserved. Interior, as trustee for the tribes, has an affirmative duty to protect tribal health and safety, to fulfill all treaty and statutory obligations, and to exercise utmost good faith in all dealings with tribes. And so that essentially takes tribes out of the stakeholder category. That says that the Department of Interior has a legal federal obligation to be the trustee for tribes and ensure that our lands are protected and that our health is protected. And you can think about, other community groups as stakeholders, and you can think about industry as a stakeholder. Tribal governments are not stakeholders in this process. We're in our own category, and it becomes very tricky when we're utilizing processes like risk assessment or health impacts assessments to really look at how to quantify and measure acceptable risks and health harms that can come to tribes. So if the federal government doesn't necessarily implement this and then the responsibility rolls downhill onto the states, then and the states aren't actually implementing this, it does become a problem and a concern for tribes that know that we have the right to be protected, our health, our safety, our culture, and our lands. We have the right to have those things protected, but instead we're getting a health impact assessment or risk assessments that is actually quantifying what is an acceptable level of risk. And we're not sure exactly who's getting to define what an acceptable level of risk is. So when we talk about these things, I think there are a lot of questions that are laid out on the table, and I think there are specific instances and details that we could give on the Wishbone Hill Coal impact assessment, but I really do believe that it comes back more to a fundamental overarching question of who is getting to decide and where is the burden of proof going to lie ultimately. As we heard before, health impact assessments are not going to stop any projects that are moving forward. And so then you have to ask yourself as a community member who's working to protect the land and the culture for future generations, for your children who are here and who we're trying so desperately hard not to pass any generational trauma down to, do we spend time working on health impact assessments, or do we find other potentially more effective ways to get the information out and move forward to influencing the government, hopefully, to actually live up to their legal trust responsibility of protection? I do believe that there is the potential for really impacted communities, tribes, and other impacted stakeholders to develop a health impact assessment that could be way more effective and have the opportunity to truly measure all of the health aspects and also make a statement around the fact that there is really in a lot of ways no way to quantify what health is worth. I mean, I'll ask all of you, what is your health worth? What price do you put on mental health, spiritual health, physical health, emotional health? How much is it really worth? How much would you pay to ensure that your children have access to those things? My son was, he was diagnosed with dyslexia last year, and the tutoring sessions were $50 a session. He needed 5 sessions a week, and we absolutely couldn't afford it. We put it all on credit, but just the idea that our son could have mental and emotional well-being because he could read. He started the 2nd grade as a non-reader, and he realized quickly he was the only child in the entire classroom that could not read. We had to then place a value, and my husband and I quickly decided we would gladly take a second mortgage out on our house if it meant that our son could be mentally and emotionally stable and secure. And so thinking about how you really make those connections and those links. I don't believe that they really give currently the HIAs, the community, greater power or authority over decisions that are affecting our health and well-being. And I even sometimes worry that they can give communities a false sense of assurance and expectation that health concerns will be truly taken into meaningful consideration, not just consideration, but actual meaningful consideration in the decision-making process. I'll be sending to Diana, who can add to the link page, some other links. One is also to the World Health Organization's definition to what health impact assessments look like, and I think that so far they look very different internationally than they have looked in the United States, and I think that says something. I don't believe currently that the health impact assessments have the ability to protect vulnerable populations, including children and elderly people and folks that have chronic illnesses or diseases, and they don't currently require any peer review. So because this is sort of a new and upcoming field, I think it's kind of a wide open place that people can even potentially take advantage, as quote-unquote pioneers in a field. And that's something that concerns me as a person who's actually participated in a health impact assessment. Like I said before, I do believe that there is the opportunity to get this right. As was mentioned earlier on the call, we are in the early stages of developing these, and people are just getting to the understanding of what it really means. But ultimately, I don't think that any community wants a tool that puts the burden of proof on them, as it has typically been, to prove why a project is bad, why a project is going to cause cancer, why a project is going to cause mental and emotional health. And there really is no way to put a price on those things. If you think about it in terms of your children and the relationships that you have, I think one of the main things that is a red flag for me in thinking about these health impact assessments is, in searching around on the internet, I was able to find health impact assessments benefits from a corporate perspective, Barrick Gold in Tanzania. And they list all the reasons why health impact assessments are going to be good from a corporate standpoint. That includes things like identifying and helping to maximize potential positive community health impacts, identifying and maximizing potential unintended negative community health impacts, identifying existing community partners, providing a mechanism to engage local health and social services, establishing respect from respective responsibilities of stakeholder groups, and also, really, it says here, providing objective data for planning development initiatives. I think when you think of all those things, that sounds good. You think, oh, good. Well, that means the corporations are generally concerned. They really want to come into the community. They really want to get a good understanding about, what impacts. But it also lists things like becoming aware of what the concerns are. It says identify and maximize the potential positive community health impacts and health opportunities of the project, which says to me that if gold mining, which could potentially have cyanide or leaching, is coming into a community, they're going to be thinking about concerns. They're not going to be focusing so much on the concerns around those things, but instead what it lists is this community in Africa has high rates of HIV and AIDS, and so they want to bring dental services to the community. And so how do communities really understand what the impacts are when they're looking at the project and they have information coming in from all different aspects, whether it's governments, corporations, nonprofits? I think it becomes very difficult, and I think in Chicklin what we've learned early on is that we have to be responsible for researching all the information ourselves, and we need to take a leadership role in making sure that we're driving the mechanism to make sure that not only is the federal government living up to their trust responsibility, but that we're also making sure to put our spiritual, mental, emotional health and well-being in the forefront, and talking about the fact that there is no way to quantify or put a price on what the health of our children are worth, or our culture, or our spirituality. And so I'll be glad to wrap it up there, and I think we open it up for questions. I especially want to thank Alaska Community Action on Toxics and CHE for working together to organize these calls. I find them to be very informative, and I really appreciate getting a chance to work with those folks.
Well, thank you, Shauna, and it's wonderful to have you as one of our speakers. Thank you for giving us a community perspective, which is exactly what we thought would be a good thing to share on this call. So thank you again. We would now like to open the lines for questions and comments, so please just wait a moment while we unmute the lines. If you'd like to ask a question or make a comment, please press *6 on your telephone to unmute your line, and please state your name and affiliation. We ask that you be brief with your comments to allow others the opportunity. And I just might say real quick, oh, I'm sorry, go ahead.
Oh, sorry about that. I just wanted to add quickly, as people are unmuting their lines, that an unexpected thing that has come out from this project, not necessarily the health impact assessment, but something that does impact our community health, is a lot of racism has come forward in our community, and I'm not sure currently that the health impact assessment, the way it is put together, can quantify or measure the mental and emotional and physical impacts of racial attacks in your own community. And so it's also something I want to add in there. And when I forward you all the links, I'll include a link to a recent newspaper article that talks about the racism that's come forward in our community.
Okay, thank you, Shauna. So, again, press *6 if you'd like to unmute your line to ask a question. If you're not asking a question, please, you can, don't press *6 or press *6 again to mute it. It can get really distracting and hard to hear. So if you're not asking a question, please make sure your line is muted. I can hear a lot of background talking right now. So, does someone have a question?
Right.
Yeah.
Yes, this is Sama from Alaska Community Action on Toxics, and it's always so good to be in these calls. I've learned a lot from all the presenters. This question is for Shauna. You mentioned that you've found differences between the health impact assessments that are internationally. I don't know if you meant the protocol they have to prepare one, and the ones that have been done here in the U.S. So I want to ask her, which are those differences that you have found that are significant to the process?
Thank you for that question, Sama, and I'll be forwarding the links around so that people can compare themselves. But if you look at the State of Alaska's Toolkit, and then you look also at the Health Impact Assessment, Why Use HIA on the WHO website, they really talk about values. The first thing that's named that is a basis for HIA to policy environment, which is being undertaken, is democracy. It says allowing people to participate in the development and implementation of policies, programs, or projects that may impact their lives. The second one is equity. Health impact assessments, the distribution of impacts from a proposal on the whole population with a particular reference to how the proposal will affect vulnerable populations, which we mentioned earlier are not necessarily being covered in these HIAs. Sustainable development is number 3, that both short and long-term impacts are considered, and it says along with the obvious and less obvious impacts, and I believe that that goes as far as the mental, the emotional, the spiritual, and other cultural impacts. And then the last one is the ethical use of evidence. The best available quantitative and qualitative evidence must be identified and used in the assessment. A wide variety of evidence should be collected using the best possible methods. And so looking at those 4 values, we can certainly see areas that studies, especially in the U.S., have fallen short. I think it really reflects and shines the light on the federal legal trust responsibility of the tribes and how that's not necessarily being upheld, but also how, in some ways, health impact assessments are, because they're so new and nobody really has, people can quote-unquote pioneer these assessments. Sometimes I have a fear that researchers can come into our communities, really look at us underneath a microscope, publish it, and get famous off of that. And then we're a model and an example, but yet the project went through, and we're still having all the mental, emotional, spiritual impact.
Okay, thank you.
Absolutely. Shauna, may I add something to that?
Yes, thank you.
I think going along the lines of how HIAs are used and historically and how they need to be thought about being improved into the future, with a lot of assessment processes, the old approach, and unfortunately it still is taken this way, is to do what folks call the decide, announce, and defend model, which you have the appearance of of stakeholder or other group participation in the assessment, but really the decision's already been made, and that's the big problem. Ideally, you're collecting this information and the input to inform the decision, and unfortunately that's not always the case.
And our kids are being receptive.
Thank you.
Thank you. Is there someone else who would like to make a comment or ask a question? Again, if you'd like to ask a question or make a comment, press *6 on your phone to unmute your line. Please state your name and if you are affiliated with a group.
Alice Chostek.
Hi, Alice.
Hi. I was interested in, since the tribe would not have stakeholder authority in the health impact assessment, I'm wondering, as individual members, if they would be considered, or if only those of us that are of a privileged race would be able to be the spokesperson for that, because of my individual close proximity to this project. You know, I'm not sure if we would need to be that voice, or if individual tribe members, as just a resident, would be able to voice their concerns.
Thanks for that question, Alice. This is Shauna, and I'll take a crack at that. I think that because the federal government has a special trust and a legal trust relationship with tribes, that actually elevates tribes up and above, because they have a special obligation. It's almost like a trust relationship, like if you have a stepchild or a foster child. You know, I think a foster child is a good example of that, and I don't mean it in a bad way necessarily, you know, to pair tribes with anything, but just to figure out how to articulate or describe the relationship for what tribes have with the federal government. The federal government, because of the history in the United States and in Alaska, have a special relationship and a legal relationship with tribes, and it's their obligation to protect tribal health and the environment, the land, and really, if those things are protected, then the tribes themselves can protect their culture themselves. And so, as a neighbor to the tribe, and as a stakeholder, a community stakeholder, that would be looked at and would fit underneath the process of a typical health impact assessment, the way they are currently structured. But it is actually up to the federal government and the state of Alaska to develop a specialized process for and with tribes, and most importantly with tribes. And honestly, I really believe that this creates a very strong opportunity for tribes and for nonprofits and for people who truly care about community health and the future of our communities. It's a great opportunity to step forward and to find ways to strengthen these models, because honestly, if tribes or elders or children are considered the most vulnerable populations, and we strengthen the health impact assessment as a tool to protect those things, all populations will then be protected. But I believe in the short term, it's very important for us to all stand together on these issues.
Okay. I think my question is, I realize that the tribe would be a total entity. I'm wondering, as I guess all of us would be able to participate in that just as an individual, or because a person is a member of the tribe, there would be silence from participating?
Limited. We almost got our nail cut off this year.
There's a, Shauna, if you were going to go, I didn't want to get in front of you.
No, I was going to give you a chance.
Okay, hey, this is Liz, Alice. A couple of thoughts, and I appreciate that sometimes the answers aren't always satisfactory because there's still so much to be done. With respect to general, and you can herd me back to the point if I'm not addressing your question, but with respect to general contributions to HIAs at this point, from folks in the public that aren't necessarily quote unquote at the table of the formal HIA process. Sometimes, if you're talking about resource development projects, sometimes you're limited basically to say public comment periods on various permits, which in some respects is a little late in the game to be coming and offering your comments in that respect, or your general letters to various decision makers within the agency or within the group proposing the project. And in some cases you do have tribal groups that are supposed to be officially at the table, but that doesn't always happen, and who's actually selected to represent the group can be an issue. So in terms of a standardized, foolproof way to participate in the process, it's not there yet.
Thank you. Thank you, Liz. We're just about out of time. We probably have time for one more question or comment, and then I also want to say that, well, go ahead. I'll go ahead and take another question or comment. Yep. Okay, it doesn't sound like one is coming forward, so if you have additional questions or comments, you can contact Alaska Community Action on Toxics at 907-222-7714, or by email at Diana, D-I-A-N-A, at akaction.org. I'll make sure if your questions are specific for Shauna or Liz that they get to them. And I also wanted to announce some upcoming calls. Wednesday, October 26th, we'll be having a call on the traditional food study that ACAT conducted at the request of the Yupik people of St. Lawrence Island. And it's a study looking at persistent organic pollutants from around the world that are accumulating in the island. Very loud. There's a lot of background noise there. Sorry. On Wednesday, November 30th, Health Effects of Exposure to Coal Dust with Dr. Michael Hendricks. And on Wednesday, December 14th, the role of synthetic chemicals in diabetes and obesity with Dr. David Carpenter and Dr. Bruce Bloomberg. And if you're on our list, you'll be receiving, individual announcements for each of those calls. Again, I want to thank you for joining us today, and we will have the MP3 of this call posted hopefully by the end of this week or early next week. Thank you so much.
Thank you, Diana.
Thank you, everybody. Thank you. Bye-bye.